Right, Dr. Kehinde Elisha speaking here, founder of MP Certification Academy, at-large representative for Loudoun County Department of Mental Health, Substance Abuse, and Developmental Services, founder of Confident Prescriber, and you can reach us, nurse-to-nursecoach@gmail.com. Today, I want to break down for you how to actually approach the CIWA calculation or CIWA in general. Now, on the exam, this is the deal. We're going to be getting, you may get a CIWA question. So the first thing that you want to know and master is this one. Let me take you to the bottom first. That, okay, what does the scale even look like? Now, we have CIWA-AR, which means alcoholism revised or alcoholic revised, like it's a revised edition. That's the AR. So now, what are the components of the CIWA calculation, of CIWA scale, is what I should say? Nausea and vomiting, tremors, sweating, anxiety, agitation, headache, fullness in the head, auditory disturbances, visual hallucination disturbances, tactile disturbances, orientation and clouding of sensorium. And I have the range. The only one that has the list number is 0 to 4. That is orientation and clouding of sensorium. And then we have description right here that tells you what it means. Nausea and vomiting, none to constant vomiting, tremors, no tremor to severe tremor, of course, sweating, no sweating to drenching sweating, and so on and so forth. And then we have orientation, fully oriented to severe disorientation, and so on and so forth. And that is the right there. So what is the scoring? So now, a patient comes to your office, right? You will now give them a scale, a CIWA scale. You will now give them this thing right here to select. They will now tell you where they are, or you will judge where they are. You know, whatever. For the most part, is a provider administered. Okay, because if somebody's having withdrawal, what do you want? You know what I mean? Like, you can also ask, but mainly it's based on your own observation. So let me say you pick some numbers here. You see that they were a little bit sweating a little bit. They had some tremors and all that. Okay. The next step is now, what are you now going to score? What grade are you going to give to them? You're now going to come to scoring tips. Each item is scored from 0 to 7, right? Except for orientation that is 0 to 4. Total score range is 0 to 67 total. Okay. So you will now total your scores and now come up with, okay, the patient actually was less than 8. Then that will be a mild withdrawal. The patient was from 8 to 15. That will be a moderate withdrawal. Oh, the patient's score was more than 15. Then that will be a severe withdrawal. And then you're going to consider medication. So you don't treat with this. You administer this. And then it takes you to the score. Now, what is your exam going to be about? So the exam may leave you right here with a scale and tell you to come up with a score. Does it make sense? Or exam may give you a score already bypassing the scale. Are you following me? Say yes in the chat if you're following me. We have a score, we have a scale. Now, ordinarily, you're gonna, thank you. When a patient comes to you, you're gonna give them this scale. When they now, or you're gonna follow through with this scale. Okay, this is just a scale. You can't do anything with a scale, but you can do something with a score. After you now administer the scale, you will now get a score to work with. You get it? Now, that's what the exam is now going to do to you. Exam will now give you a scale in form of question that will look like this. So now let's go ahead and take a look at that question. So the one on top here, you can come back and reference how I got my numbers. That's why this is up here. All right. So now let's take a look. A patient undergoing alcohol withdrawal, score severe, which is 7, on nausea or vomiting, sweating, anxiety, moderate on headache and tremors. The rest of CIWA categories are 0, which is what is the total CIWA-AR score? Now they're asking you for score indirectly, directly or indirectly. Now they have given you a scale to work with. Does it make sense? They have given you a scale to work with. So you now have to come with a number. And when we have a multiple choice here, of course, 29, 31, and all that. And it's broken down here how it's done. Nausea and vomiting, 7. Sweating, 7, because it's a severe one. Headache, these are all moderate. And of course, others are 0. And then you put a 0, then you add it all up, and then you get your answer. Now, this is the deal. How else can you be tested on this one? Sometimes, examining body will also give you this score right here, 20, let me say 29. They will just give you, a patient comes in with a CIWA, or you have a patient with a CIWA score of 29. What will you do for the patient? How can you support the patient? You know, so you will now say, okay, Let me quickly think what I learned in Dr. K's class. Let me now quickly go to my score scale, like not the scale. You will go to my final score to see where 29 really falls. And you know it's definitely severe, but let's take a look. Let's take a look together. So you will now come to this table and say, okay, where is 29? 29 is under severe withdrawal. And then you'll be able to do meds for that. That will be a straightforward question. But it's a little bit indirect if they're actually giving you a scale to deal with. And that is where this kind of question will come in. It doesn't mean you will get this exact question, but it's very similar. This question is under assignment. I put the answers there and the step-by-step on how to do it. Don't put more than 5 minutes into this. I am pleading with everybody because you have other things to worry about. You have to distribute your time well. Don't be putting so much time into neuro that you forget about psychotherapy. Don't be putting too much time on farm that you forget about roles and leadership. No, roles and leadership, therapy, they're equally as important as farm and other sciences. Everything is important. We have to balance the scale, period. All right? I hope you understand now, right? We're now going to shift gears and move to the rest of the psychiatric assessment. This is nothing. This is just a little bit. Okay, that's what I'm saying. Don't maximum 15 minutes. Don't put more than 15 minutes into this because you have other assessments to worry about. Assessment is more than 40% of your question. So we have a lot of work to do. Let's get started. Do we have any questions? Speaking is Dr. Kehinde Elisha, founder of NP Certification Academy. To reach us, nurse-to-nursecoach@gmail.com or visit www.npcertificationacademy.com. You can also call 347-901-6037, but mostly you can text. It will be much better that way to reach us. And our website is very straightforward. It's right here, nurse-to-nurse, npcertificationacademy.com. Thank you so much and have a wonderful day.